Hello everyone, my name is Jenny Pearson and I am the Global Clinical Marketing Specialist for the Logic E9. Today we will be talking about B-Flow scanning tips on the Logic series. When using B-mode imaging, tissue is visualized in the image and the blood flow is not normally visualized well due to the weak echo signals of the red blood cells. B-Flow is based on a B-mode technology. In contrast to B-mode imaging, B-Flow essentially suppresses the tissue and enhances the weak signal echoes of the red blood cells, which gives us the ability to see small vessel perfusion and hemodynamics within larger vessels. A major advantage of B-Flow technology is the ability to show the true vessel diameter, which gives you the advantage of showing the delineation of the vessel wall in cases of carotid plaquing or small vessel perfusion in a kidney transplant. So what are some of the clinical indications for B-Flow? B-Flow may add benefit when visualizing small vessel perfusion through an organ, such as the kidney. As you can see in this image, very small vessels are visualized in the periphery of the kidney. This can be especially beneficial when assessing a kidney transplant. In the liver, a physician may want to assess the liver capsule in cases of liver disease. This image shows the excellent spatial resolution in liver capsule vessels. The spleen may be assessed to check the overall perfusion. The neonatal head can be evaluated for many types of pathology. B-Flow may provide additional information when looking at scrotal perfusion, when checking for absence of flow in the case of a partial torsion. A breast or thyroid mass may be evaluated for vascularity as seen in this image. And in addition, B-Flow may be helpful in visualizing placental perfusion. B-Flow may be used to assess perfusion through areas of inflammation, such as lymph nodes, as seen in this image. When looking at perfusion through a lymph node, compared to PDI, B-Flow shows the true vessel diameter, which accentuates very small or tortuous vessels. B-Flow may be used when evaluating for tendinitis or appendicitis. Here is an example of inflamed tendinitis in the elbow. B-Flow can be used when assessing hemodynamics. In this carotid stenosis, the hemodynamics are clearly seen, and the true vessel diameter is visualized. When looking at a fistula or bypass graph, B-Flow adds the extra advantage of excellent spatial resolution when evaluating the flow. Slow, spontaneous flow in the venous system may be seen due to the detection of the weak echo signals of the red blood cells. The to and fro flow within an abdominal pseudoaneurysm, as seen here, is well visualized with B-Flow. B-Flow can also be used in cases to detect movement. For example, as we look at this image of an umbilical hernia, B-Flow was used when doing the Valsalva maneuver to assess the hernia. B-Flow may be used in detection of peristalsis in the bowel. In pediatrics, assessing ureteral jets can be part of the protocol when doing a renal scan. B-Flow can assess the ureteral jets in the bladder as seen on this image. Now we will demonstrate how to optimally scan a few of these areas. The liver surface may be assessed with B-Flow in cases of liver disease. To scan the surface of the liver, place the patient in a left lateral decube position. Scan intercostally to obtain an optimal window to visualize the liver surface. Optimal depth will be around 6 centimeters. In addition to the liver surface, portal hypertension or a tip shunt may be assessed to show the portal venous flow and hemodynamics. B-flow may be an additional tool to assess perfusion through the kidney, improving visualization of vessels in the periphery. With the patient in a left lateral decubitus position, scan posteriorly to obtain a superficial window of the kidney. This will show the best resolution in the periphery. B-flow or B-flow color may be used in this position. In addition to B-flow, we have B-flow color technology. B-flow color provides you with better spatial resolution compared to PDI. This may be useful in a case where you may want to see tighter vessels such as a renal transplant or the surface of the liver. B-flow color may also be used in areas other than general imaging, such as rheumatology, as seen in this image. This is an example of B-flow color in the finger, using the L8 to 18I probe. Lastly, when using B-flow and B-flow color, we suggest using the high-frequency ML6 to 15 probe when you are scanning more superficially. This will be the preferred probe to use in the case where you are imaging structures less than 2 centimeters in depth. In a case where you are deeper than approximately 2 centimeters, we suggest using the 9L probe, which will provide the user with enhanced visualized flow at a deeper depth. This concludes our session on B-flow scanning tips.